Hello everyone, I'm Oishik, a PhD student from Stony Brook University. I'm presenting our work Enhancing Modality-Agnostic Representations via Meta-Learning for Brain Tumor Segmentation. The motivation behind our work is that accurate segmentation of brain tumors can expedite clinical procedures and aid treatment planning. Standard brain tumor segmentation methods requires all the four modalities FLAIR, T1C, T1 and T2 during the training and the inference stages. However, in clinical practice, only a subset of modalities may be available due to patient movements, erroneous machine settings, etc. Existing segmentation models fail to handle such missing modality scenarios. So the question we are trying to address is, can we train a high fidelity tumor segmentation model which is resilient to missing modality scenarios in both training and inference stages? The existing solutions to handle missing modality problem are knowledge distillation like KDNet, but these methods are computationally inefficient and they require access to full modality for training the teacher model. Next comes the GAN-based image synthesis like MMGAN, but their training has a non-converging nature and generation of 3D images makes it further unstable. The final are the shared latent space models like HEMIS, which relies on the calculation of statistics like mean and variance, but they are unable to recover the lost information otherwise present in the full modalities. One major disadvantage of the above models is that they either utilize the full modality for all subjects or simulate missing scenarios from this full modality data. However, our approach works in a limited full modality supervision where the entire dataset D is divided into two proportions DM and DF. In DM, the subjects need to have partial modality data, and in DF, the subjects need to have full modality data. The major contributions of our work is adopting the meta-learning strategy which utilizes full modality only during meta-tests, and hence our approach can operate in a limited full modality supervision. It mitigates the model bias against modalities which are rarely encountered during the training. It also makes the model generalizable by training across a variety of tasks. We also propose an improvised adversarial learning strategy to reconstruct the missing modalities in latent space and enrich the partial modality representations with the information otherwise present in the full modality space. This is an overview of our framework. On the left-hand side, you can see the meta-training stage which operates on the partial modality data, and the right-hand side is the meta-testing stage which operates on the full modality data. Now let us go through the details of our framework. In the meta-training stage, some of the modalities are dropped to create the heterogeneous task distribution. Swin transformers are used to extract features from these available modalities, which are then combined by an attention-weighted fusion module. The fuse representation from the bottleneck level is used as input to the discriminator, which predicts the absence of modalities and forms the core component of our adversarial learning strategy. The same fuse representation is used as input to the decoder to perform segmentation. In the meta-training stage, the inner loop loss is calculated on the partial modality. Next comes the meta-testing stage where the full modalities are used as input to our model and the outer loop loss is calculated on the full modality. These are the quantitative results of our approach. It should be noted that even if we use 50% of the full modality samples, we're able to outperform the state-of-the-art benchmarks by 11% on the whole tumor, 12% on the tumor core, and 9% on the enhancing tumor regions for BRATS 2018. We also conduct a few ablation studies in order to highlight the different aspects of our framework, like our model is robust to adding proportion of full modality in the training. It is also not biased to presence of a particular modality like T1C. We also depict the importance of the major contributions like GAN and the meta-learning. And even when trained with 50% full modality samples, it can consistently outperform other methods like ACN, RFNet, and MMFormer. These are the segmentation maps achieved by our method. It can be seen that even when modalities are missing, these maps do not degrade sharply. These are some additional qualitative maps. So to summarize our work, we present a novel training strategy to perform brain tumor segmentation under limited full modality supervision and with missing modalities. We adopt meta-learning to mitigate the bias towards rarely occurring modalities and use full modality only during the meta-testing phase. And finally, we apply an improvised adversarial learning in the latent space to generate superior modality agnostic representations. Thank you for listening. Please attend to our poster.